function of the jaw. This relates directly to cranial nerve number 5. I'm going to start by checking for any atrophy of the jaw, and I'm going to palpate the masseter. So I'm going to reach in, and can you bite down for me? And I'm feeling for any weakness. I'm feeling that bulge in our jaw. Okay, wonderful. I'm also checking for atrophy of the masseter. So if there's any deterioration of the jaw, any reduced contraction, and also structural restrictions. I'm also checking for any adventitious movements, so any sort of tremor or fasciculations. Do you have any fatigue while chewing?
No.
Okay. And let me get my pen. All right. So I'm now going to check for the function. Can you open your mouth as wide as you can for me? And then close it. One more time, open as wide as you can. All right, and close. And can you lateralize your jaw left and right? Left and right. And I'm checking for a range of motion. All right, so everything seems to be good. Thank you. Now I'm going to check for strength. So I'm going to see how we can do against resistance. So can I have you open your mouth? I'm going to push you a little bit. Okay. And now could you lateralize your jaw? This side, I'm going to push to the side. All right, and then this side. All right. Everything seems to be within normal limits. Okay. Now I'm going to move on to cranial nerve 7, the facial nerve. I'm going to check, I'm going to look at your lips. So this relates to cranial nerve number 7. So let's start with, I'm checking for any atrophy of the lips. Any adventitious movements, any hyperkinesias or fasciculations. I'm also looking for any resting tremor. I'm looking for a facial droop, any sort of facial droop. Okay. I'm now going to check for range of motion. Can you protrude your lips like this for me? Perfect. And can you retract your lips, a big smile? Oh, and again, I'm looking for any sort of facial droop. To one side, if one side is not retracting and the other side is. All right. And can I have you smile to the left, smile to the right? Perfect. All right, now I'm going to assess for strength. Can you purse your lips really tightly for me like this? Good job. Can you close your lips tight as you can and hold them shut? So like this, purse them and hold them shut. And I'm going to pull from the sides. So I'm checking for any strength, any weakness in our lips. There doesn't seem to be any. Okay, thank you. And can you puff your cheeks out like this? Perfect. And just hold that. And I'm checking to see if any air escapes when I push. I'm not seeing any air escape, so it seems like there's no weakness in our lips. All right. And we're going to check of coordination for movements. I'm going to have you alternate between a pucker and a smile.
Mm-hmm.
And if it helps, we can try wee. Perfect. All right. Thank you. And can we now try pa 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 as fast as you can and as controlled as you can?
Pa 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 pa.
Excellent. Thank you. All right. We're going to now look at the velopharyngeal function. We're going to check out, this will be our next cranial nerve. So I'm now going to look at the mouth and observe the velum. So I'm going to get my flashlight. So this will be for cranial nerve 10, our vagus nerve. Open as wide as you can. Okay, and I'm looking to see if there are any sort of drooping or any sort of left side or right side of weakness of the velum. I'm checking to see if the velum can elevate and if there's any asymmetry, or if it's bringing to one side or another. So if there's any asymmetry, so if it goes from one side to another, that would indicate some sort of unilateral weakness. Can I have you hold out for me? I'm gonna look inside. Good job. I am gonna need our tongue depressor for this. Alright. One more time. One more time. Okay, wonderful. All right. So I'm also going to check for any sort of nasal emissions. So I'm going to have you say and I'm going to plug your nose. So okay. And I'm checking to see if there's any weakness of the velum. So I'm going to have you take a drink of this water. Could you take a drink of this water for me? Okay. I'm seeing if she can build the kind of pressure that we need to get that solid seal on the straw. I'm also checking for any advantageous movements, any tremor or fasciculations. Can I one more time? Okay, thank you. All right, so now I'm going to further test the function of cranial nerve number 10. Can you show me a sharp cough? All right, I'm seeing. See if you can get the vocal fold. I'm seeing if I can get the vocal folds to adduct with force. So one more time. Good job. Can you say and hold it for me? I'm listening to the quality. I'm listening to the breath. If there's breathiness of the vocal folds, then they can't adduct and air is escaping. So that would indicate weakness of cranial nerve number 10. Now just breathe normally. I'm going to listen for any striders of resting breathing or of rest breathing to see if there's any weakness in terms of abduction. So let me just listen to you breathe normally. Okay, thank you. All right. And lastly, we're going to go to cranial nerve number 12. I'm going to assess the tongue. So can I get you to one more time? All right. I'm checking to see if there's any atrophy, any advantageous movements, tremors, or fasciculations. If there's any resting asymmetry, one more time. Okay, thank you. I'm also looking at the colors. So if there's any inflammation, if there's any lesions or evidence of thrush. I'm now going to look at range of motion. Can you elevate your tongue for me like this? And down. All right, thank you. And can you stick your tongue out as far as you can? Thank you. I'm now going to ask you to lateralize your tongue to the left. Right. Thank you. I'm checking to see the ability of contraction or coordination. Sorry. Actually, before I do that, I'm going to assess strength. So I'm going to hold the tongue. I'm going to use another tongue depressor. And I'm going to stick your tongue out and lift it up as hard as you can. Good job. And now I'm going to put it to the side. Can you try to move that tongue depressor? Great. And then this one. Thank you so much. All right. So I was assessing for strength. All right. Next, I'm going to ask you. Can you sweep your tongue around your teeth like this? Thank you. Okay. Wonderful. And lastly, now I'm going to assess respiration and phonation. Will you please breathe normally for me? I'm just going to listen. So I'm observing breathing at rest for any shortness of breath, any use of accessory muscles, any big breathing, but I'm not seeing any of that. Are you feeling fatigued when you breathe? Will you cough strongly for me? All right, this requires muscles of expiration. For her to get that nice big cough out, she needs those muscles of expiration. I didn't see anything that would be any cause for concern. I'm also listening for any striders. I'm also not seeing anything like that. Any loudness variations, and I'm not seeing any. Do you have any shortness of breath?
No.